Hi guys. So today I'm reading this book and I'm in a little bit of a different environment due to some things that I'm dealing with right now, and my husband's work and all that. Anyway, what I found interesting in this book, and this is the chapter's called Child Disassociation's Roots in Adulthood. These are protective functions of disassociation, and it has a lot of history in this book. As states here, although diagnostically distinct, it is generally accepted that there is considerable overlap between disassociation and post-traumatic stress, and some authors choose to see multiple personalities as a chronic post-traumatic stress disorder, Klesson, 1993, in which disassociation is seen as a defense often mobilized against the pain and helplessness engendered by traumatic experiences such as incest and combat. Spiegel, 1986. Frank Putten enumerates the protective functions of disassociation as A. Automatization of certain behaviors, B. Resolution of inconcealable conflicts, C. Escape from the constraints of reality, D. Isolation of catastrophic experiences, E. Cathartic discharge of certain feelings, and F. Analgesia, that's a tough one, and G. Alteration of sense of self, so that a traumatic event is experienced as if it is not really happening to me. Putten, 1993. As a defense, disassociation is seen to have a double edge. It provides protection from the immediate experiences, but results in long-term fragmentation of the self. So next we have Kluft in this book as well. There seems to be a lot of different doctors and the dates and their discussions and research. And Kluft has the four-factor theory here. 1. The capacity to disassociate. 2. Overwhelming life experiences during childhood that cannot be dealt with by other defenses. 3. The idea that the dissociative defense is shaped towards personality formation by being linked with other psychic structures. And 4. A lack of nurturing and healing support before the process becomes relatively fixed. And this was in 1984. So next in this part of the book, it talks about kind of why DID isn't really noticed in childhood and why it becomes presentable starting in adolescence into adulthood. But there are other reasons for the lack of dissociative diagnosis among children. Some authors have argued that there are atypical presentations in child and adolescent cases, or that personalities are not well enough developed to be classified as DID, or even that there is relatively little difference between young alters and age-appropriate behaviors of children, such as playing with imaginary friends. Tyson, 1992. Frank Putten has made an impassioned argument that the DSM operated under the misguided principle that whatever possible adult criteria should be applied to children and adolescents. But in the case of children's dissociative disorders, such as adult diagnostic criteria, are grossly inappropriate and misleading. Clinicians tend to report more ambiguous dissociative symptoms among children, which involve less fully developed DID or are inappropriate for the label dissociative disorders not otherwise specified, so OSDD. To counter these problems, various checklists of childhood disassociation have been proposed, including Kluft, 16-point checklist of symptoms. And that was done in 1984 already. Putten, 1981 checklist, and Fagan and McCohen, 20-point checklist of teacher and parent observation. More recently, attempts have been made to develop a dissociative subscale in the widely used child behavioral checklist, and a whole range of scales have been developed, both self-report and parent report, to specifically measure levels of disassociation in children, the most popular being the Child Disassociation Checklist, the CDC, by Putten, which has been widely used and validated in the last few years. Putin and Peterson, 1994. The CDC measures behavior in the following domains. 1. Dissociative amnesias. 2. Rapid shifts of demeanor, knowledge, abilities, or behavior. 3. Spontaneous trance states. 4. Hallucinations. 5. Identity alterations. And 6. Aggressive and sexual behavior. So I'm going to keep reading this, and here in part 2 I'm going to read this and then give you a little bit of my own background so you have a little more understanding of things. It states here, research is also underway to explore the hypothesis that adolescence is a crucial period for the consolidation of dissociative disorders. Several authors have made important theoretical contributions to the understanding of adolescence and dissociative experiences. In the last few years, Armstrong, Putin, and Carlson have been working on an adolescence dissociative experience scale, which is a ADES, a 30-question self-report form for the use with adolescents between the ages of 12 and 18, and covering experiences in the following domains: dissociative amnesia, absorption and imaginative involvement, passive influence, and depersonalization and derealization. And that's done by Armstrong, Smith, and Carlson. In a report on the checklist, the authors pointed out that adolescence may well be a transition point for dissociation, the period at which normal dissociative tendencies, such as identity confusion and imaginative involvement, begin to diminish as adolescents move towards adulthood, while pathological dissociation may well interfere with the construction of a cohesive sense of self and solidarity into more fixed patterns of adult dissociative disorders. Dissociative adolescents often present with depression, suicidality, self-harm, learning difficulties, auditory hallucinations and aggression, and sexual promiscuity, and may have been previously diagnosed as having a conduct disorder, borderline personality, attention deficit, hyperactivity disorder, or post-traumatic stress disorder. Now, before I read the conclusion, I want to explain that. Growing up, most of the percent of people that I know that have DID, they usually do not show obvious signs of DID as children because it is a coping mechanism. So it's really not even DID yet. It's something that is used to cope through an awkward situation, a very extreme, severe, traumatic situation. So at that point in time, it's a good coping mechanism. It's helping the child cope with whatever severe abuses that is taking place. But then as you start to climb into that little middle age of like 12 to 18 in there, you start noticing you don't quite fit in. You're different. You're oddly different. And then you start to notice things that other people don't do, okay? For, say, missing time. As a child, you're really not going to notice it. But as you become an adult, you're like, okay, where did this class go? And it was odd because it shows in my records. I had to take English 2 years in a row, over and over, until my English teacher figured out something wasn't quite right with me, because for some odd reason, I could do the reading, I could do the work, and if he'd given me the test right after that, I'd have aced it. Then all of a sudden, something's not right. I was forgetting. I had amnesia over the weekend, and I'd come back and I'd be staring off, and he'd be saying, why did, I'd fill out the test with all the wrong answers, and he'd be like, what is going on? And I wasn't going to just tell him, I lose time. I just basically lied, and I would say, I guess I didn't study hard enough, or basically saying, I'm stupid, I failed this, blah, blah, blah. And it was funny because when we started digging into my history, my report cards show fluctuation in good, and then all of a sudden they drop again, and then good and drop again, because I was switching. I was dealing with dissociative states, self-harm, my own sexuality at the time. I didn't fit in with anybody. I didn't have friends much. So let's give you the conclusion now. So this is going to getting and showing symptoms as a teen. In 1984, Richard Kluft, a leading worker in the field, wrote of childhood disassociation, the essential paradox it presents. Although adult dissociative disorders are generally felt to have their own roots in childhood, there is a plausibility of literature in childhood disassociation in and of itself. 15 years after Kluft first drew attention to the paucity, I think it means plausibility, but I think they misspelled that, of literature on child and adolescence disassociation, the situation has been transformed. With the creation of research tools, the publication of numerous articles and several books specifically on this topic, and the growth of clinical hours and theoretical understanding of the problems young people face. So remember I mentioned before, they do study, and I have students come in to get their credit, their clinician time in. Why has it taken so long for this understanding to emerge? Is it a question of cultural perceptions, professional attitudes, or their personal resistance to recognizing such states in children? Ironically, it was only with the growing understanding and investigation of adults with dissociative disorders that the need to explore childhood dissociation became imperative. The hypothesis that adult dissociation has its roots in childhood obliged professionals to turn their attention to children or young adults themselves. In order to confirm or disapprove this hypothesis, the whole field of child and adolescent disassociation, we could say, had its roots in adulthood, and is only now that the field is being understood in its own right. But it is not just understanding that is necessary. The recognition of the particular dilemmas faced by children and adults with dissociative disorders is paving the way with far more appropriate treatments and, more importantly, early primitive interventions. Childhood experience is no longer simply seen as a heretical root of adult dissociative disorders. It has come to be recognized as a period in which dissociative defenses and symptoms first develop, and a crucial point for effective clinical and social policy interventions. So let me go back in time again. Now, if somebody would have just noticed, me staring off in my teen years, the self-harm, the suicidal ideation, all that would have been brought to the attention it needed to be, or I would have got the proper treatment. Could have this disorder been less? Yes, absolutely, 100%. So it is vital that if you have these symptoms that you talk about it with your mental health care professional, because the longer you wait, like for me, I'm older, so now the symptoms have regressed, gotten so bad that my body is reacting to it now. My nervous system's reacted to it, my gastrointestinal is acting to it. So these are vital things to why, if you are young, if you're like you're like 15 to 20 years old, don't come to me for help. Get these symptoms under control. Talk to a therapist or a psychologist. Most of the time, you're going to get diagnosed with multiple different diagnoses before you get diagnosed with DID, because they have to rule out all other aspects. So I want to have a little bit of a discussion before I end this video. One is that allowing alters to educate on DID could be harmful based on past belief of those alternative states. It can harm a lot of people. It can also harm you. It could cause separation more. The idea is that your brain is a coping mechanism making this. And as difficult as that is to believe, the more you separate your alternative states with names, ages, even though they may have a name, may have an age, may have specific things they like, which mine did too. But the idea of keeping them out of the public eye is probably best. And if you see videos that have this kind of misinformation, or that's really over glamorized or harmful or sexualized content, quietly mass report that page, have it taken down. I will repeat again, if you do not have the guidance of a therapist, knowing of your account, your YouTube, your TikToks, I would suggest you do, because the idea is to have support and understanding, and for alternative states not to give misinformation. So again, try to stick to learning about it, healing it, and not glamorizing it for fame and attention. It seems to be a big thing on TikTok. The more it grows, the more issues there are. I suggest mass reporting that account and having them taken down, because they are not giving the education that you need. Now, me, on the other hand, I read, I learn, I study, and I've been at this for over 10 years. My content is also somewhat monitored and understood and watched, and I recommend my videos for therapy, because it can help your therapist or your psychologist to understand more about DID. So that's pretty much all I have today. I will definitely be trying to make educational content. I needed a break. The bullying is getting horrendous, and so kind of detouring away from things just a little for like a couple of days to spend time with my family and to work on me. Anyway, that's all I have today. Loves. Bye.